Associates. He completed his training internationally, so he received his undergraduate degree in France and completed his MD there as well, and then came to Mount Sinai for his neurosurgery residency. He has been a widely regarded high quality neurosurgeon around the New York region, and is also frankly a Renaissance man with many interests. So we're looking forward to hearing from him today.
So the concept for this talk initiated by the realization that a neurosurgical procedure is unique in many different ways. It's unique because of time, because of the time that it takes to take a procedure as a neurosurgical procedure, and because that time flows constantly. There is no red light, there is no intermission, there is no timeout in a neurosurgical procedure. And that's why I picked this little video of a stream that keeps on going the same way as a procedure in neurosurgery.
Frank?
Just keep on flowing.
I don't think we see your, do we see?
We're not seeing your screen, no.
We see you, Frank, but we don't see what you're sharing yet.
Are you seeing this?
Not yet.
Am I not sharing the screen?
No.
Okay.
Sometimes
the green screen share button at the bottom.
Yeah. I did that. Let's try again. Is it sharing now at all?
No.
What about now?
Yes.
There we
go. Okay, let's try again. So you're seeing me now?
Yeah.
Great. Sorry for that. So much for a Renaissance man. So as I mentioned, I don't know if you heard the beginning of this, but one of the reasons why I wanted to give this talk was the realization that a neurosurgical procedure is unique in many different ways. It's unique in its time, and when time flows through a neurosurgical procedure, the same way as you can see this river flowing through this beautiful scenery, there is no timeout, there are no intermissions, there's really no way to stop the procedure once you get going. And in that respect, there are very few things in life that you can't really stop at least on daily life. Life itself obviously never stops, but any sports activities has a stop for commercial break, or for you can stop and have a drink. That just doesn't really happen in neurosurgery. Once you start that case, you're committed and you're going to be doing it. I picked this particular river because I like the combination of nature and humanity that surrounds it. And it's a little bit what's happening in neurosurgery, where we deal with nature, but obviously in a very human surrounding. It's unique also because of the fact that we're proceeding with our own hands. It's a manual task. There are very few things that are left that are done by hand in a world where everything is manufactured. And we'll discuss this a little bit further on, but if you think of your friends and colleagues and you wonder who does anything with their hands anymore, you'll realize that surgeons are some of the last ones to work with their hands, obviously until the robots take over. It's unique because it's one of these moments where there is a transfer of positive flow from the surgeon, the surgical team, to the patient. And once again, that is something that's quite special in today's life, where you can actually transfer positive energy from one person to the next, since the goal of the procedure is to restore the flow of health in the patient. And then finally, it's unique because no two cases are similar. Even though we may feel that we are repeating ourselves from one case to the next, the pathology is different, the bodies that we operate on are different, and therefore using this river analogy, I wanted to quote Heraclitus: "No man ever steps in the same river twice, for it is not the same river, and he is not the same man." And in my last talk that I did during the pandemic, I spoke about endurance, and I brought Shackleton, and I wanted to link those two a little bit, and the fact of that we're dealing with rivers right now with this tremendous feat, which is this race around Manhattan, where a lonely swimmer, you can see this person here swimming, goes for 28 plus miles around the city of Manhattan, and does so by swimming under 20 bridges, hence the name of the race. This is a little bit what happens in neurosurgery. You're all alone, you're swimming in the flow of things, and therefore it comes to no surprise that this particular swimmer should be a neurosurgeon, none other than our colleague, Dr. Kevin Yao, who performed this incredible task in a little over 8 hours, which is an astounding feat. Staying in the field of rivers, but now transitioning a little bit more to the meat of our talk, I wanted to bring up one aspect that I always enjoy, is the similarities in nature. So on the left side, you have the river Ganges as it finishes in its delta, and obviously on the right side, you have an image of a cerebral angiogram type. And I love that similarity between nature at so many different levels. But blood flow, as the title here mentions, is the first flow that we encounter when we do surgery. It's the first thing that happens once you start incising the skin. And if you think about it, it's kind of the only response the patient has to tell you that he or she is alive under the knife. Every other function is controlled by the anesthesiologist, but the blood flow is the one that we need to control. And in order to control that, we need to obviously have a great knowledge of general anatomy, but also a very accurate knowledge of what I would call the microscopic anatomy. And a good example of that was provided by Dr. Bettison last week when he described how to identify and then coagulate and divide the small vein, the CP angle, the petrosal vein. And for the residents, I think it's important that you realize that the control of the blood flow is what's going to make the case either beautiful or not so beautiful. And if you can identify the surgeon who makes it look easy, then by all means, take the time to identify what his techniques are. My mentor, the chairman at Mount Sinai 3 generations ago, Dr. Malice, for instance, would increase the magnification on the microscope whenever there was bleeding. Instead of decreasing it and doing blanket coagulation, he would want to identify the bleeding spot and then weld it in place. And those are little techniques that you can only learn by watching and watching. And I would suggest that you spend a significant amount of time watching the masters that you have around you perform surgery. The flow in the operating room is a difficult endeavor. When you walk into the operating room, it is a theater after all. And you need as a surgeon, you need to set the tone of what the play is going to be like. In order to, you're the one who's going to set the attitude of the case, the tempo of the case, and all of these aspects are going to have a very important effect on the outcome of the procedure. And this comes from a combination of items. Obviously, skills. You have to be totally aware that you have the best possible skills for the task, and we'll talk a little bit more about that. But you need to come in there with a feeling that there is no room for failure. It's not in the DNA of the surgeon to accept that there's going to be any possibility that you're not going to complete the task ahead. Communication is vital. It's impossible for the surgeon to go through this alone, and you need to be able to communicate not only what's happening now, but what you want to do in the next few minutes or the next few moments. And for that, you need to have a clear vision of what you're going to do, hence anticipation. You need to be able to know ahead of time what to expect. And the most important part of surgery, Dr. Malice would teach us, is not the actual surgical technique, it's the preoperative planning. And in that respect, it's something that has to be extremely clear. When you cut skin, you know what you're going to be doing. You're not going to go in there and try and figure out what you're going to do. There's got to be, obviously you can change your decision making, but there's got to be a very clear view of what you're going to do. Focus makes obvious sense. One of the aspects of focus that I would emphasize is that in order for the flow to work well throughout the procedure, you need to keep your eyes focused in the wound. You can't just keep on looking up, around, looking at the scrub tech. You got to take an instrument, use that instrument as long as it can be used before it loses its use, and only then return it to the scrub tech, and then keep on going with yet another instrument, so that you keep the flow going and you don't fall into what Dr. Bayoun at Elmhurst used to call butterfly surgery, where you change instruments, you look in, you look out. That's probably not going to help you with the flow. And so you may be wondering, what's that coffee cup doing on the side? And the flow in the operating room, and that's probably the crux of what I wanted to say during this talk, is not just what happens in the operating room. It's what happens in every aspect of your life around it. So it will be from the way you put on your pants in the morning, the way you put your coffee cup down on the coffee plate, the way you deal with the fabrics of every day, whether they're your clothes, your towels, your sheets, because essentially the way you deal with the fabrics of every day has an effect on the fabric, the dealings you have with the fabric of life in the operating room. And the body, the human body, is just another aspect of a fabric that you have to deal with. And if you have an understanding of every movement that you do outside of the operating room, it will help you with the movements you do in the operating room. Flow of hands, obviously, is primal. And I couldn't resist but showing again, which I did during the last talk, the sushi Naz performing this simple task, but in such a beautiful way that you immediately understand that this is a master of his trade. And he was kind enough to do this during the pandemic for us, but your flow of hands has to come from decades of exercises, basically. You're born with your hands, you have to constantly work with them. And talking about decades, every millimeter, as Dr. Bettison mentioned in one of his Vimeos, every millimeter we deal with has consequences in neurosurgery. And that's true whether you deal with spinal or cranial surgery. Every millimeter, if you think of it, can change decades of life. It's an interesting link between space and time, where a small mistake at time of surgery can have a fatal outcome that can last forever and ever. So it behooves us to keep our hands in the best possible shape, and for that, once again, the use of fabrics during the course of our day. But what I enjoy also doing is, for instance, juggling, or just exercising the hands, or doing magic tricks with my daughter. Flow of breath. You can't, neurosurgery is a very physical activity. We always talk about the intellectual aspect of it, but it's such a physical task. I was looking at the Olympics, and you have these athletes that train and train forever, and then they have their moment. And in neurosurgery, we train forever, and then we have this moment. But because it's not on social media, it probably is not getting the recognition that it is. And because we need to have a gold medal every time, we have to be in the best possible shape. And I think that it behooves us once again to be in the best possible condition to do these surgeries. So breath is an important aspect. We ask our patients to breathe in deeply before they go in under anesthesia. And if you don't have time to meditate or to exercise your breath, you can also just take 3 deep breaths throughout the day. And basically following the recommendation of Eckhart Tolle in his powerful book that's called The Power of Now, a book that I would recommend. And at the end, you'll have an option to get all these quotes that I'm giving on the little QR code. One of the aspects that I personally enjoy with the activity of breathing is when I scrub in before the case. I use that moment, that lonely moment, to visualize the case ahead, and to take a few deep breaths. And the nurses were initially laughing at me because they could see my hands kind of looking as to what I'm going to be doing as the whole case is going to unfold. Because as many times as you've done it, every case is going to be different. Flow in life. Well, I alluded to the fact that who you are outside of the operating room is who you are in the operating room. And so sometimes you may be coming to the operating room in a position that may not be so optimal. Maybe you had a bad night, maybe you're depressed, maybe you're hurt, maybe there's something that's happening. And yet we all know that when it comes to operating, you have to keep all of these things aside. You have to fall into the zone. You have to get into the flow of what's happening. You have to create this bubble that allows you to excel, and there is no room for failure, as I said. So it behooves us, once again, and I've been using this expression, to be as prepared as possible before we come to the stage of the operating room, which brings us to the flow of life. And when I put that title up, the 2 words seasons and reasons came up. I was discussing it with Alex, my son, who is the one who helped me with this talk, and I thank him for that. And he came up with this little succession of Polaroid photographs of the seasons. I think it speaks for itself. Obviously, there are seasons in a surgeon's life. There's also seasons that go in a year, and there'll be moments that will be probably a little bit more successful than others. And when it comes to reasons, this becomes a little bit more ethical, but sometimes there are reasons why a case doesn't work exactly the way you want to. Sometimes these reasons are yours, and sometimes they may be part of a domain that's much greater than you are. And so I will leave everyone think about this in their own terms, but I figured I had to put these words up. Going on with a vital aspect of what we do, because as physical as it is, we are intellectual beasts. And so when referring to flow of thoughts, I called up my friend Erling Kage, who's an incredible explorer, philosopher, and writer who wrote several books, this one on walking. And I asked him, what did he think about the concept of flow? He walked to the North Pole, South Pole, he went up to Mount Everest. And he said, when you're in the flow, you're essentially in a very silent place. And I thought that was interesting because in the operating room, everything is so noisy and so forth. And he also brought up the term of ecstasy, which I'll come back to. So yeah, I think that if everything jives, you're going to enter a moment where I guess the NBA basketballs can shoot every 3-pointers that they want, a moment where every move you do is just going to be the correct move. And in his book, which I recommend, I opened up to this page at a beach which Dr. Bedison will recognize. And on that page, I wanted to read out this little quote on the importance of not taking shortcuts, but instead using one's time to struggle towards a goal. Receiving too much technical help is a reckless theft of humankind's reserves of experience. Big words indeed. It's pointless to ride to the top of a mountain in a car or helicopter instead of hiking or climbing up, because the experience of standing on the summit is superficial if no pain was involved. And so I wanted to put that quote specifically for the residents. All of us live through that, but for all of you who are going through residency, I know what it's like, and it's going to be tough. But the reality is, it's got to be tough, because if it's not, you're not going to get this Olympic moment of being able to go through the whole process of a neurosurgical procedure by yourself. And luckily, you're surrounded by masters who will teach you. So Erling Kage also told me I should follow up with this book. And I didn't realize that, before I even started this talk, that there was a book called Flow. So ultimately, obviously, I'm not reinventing the wheel. This gentleman, Mihaly Csikszentmihalyi, wrote an incredible book. Once again, something to be recommended. And in that book, he is able to identify 8 characteristics of flow. So I thought we'd quickly go over them as far as neurosurgery is concerned. And number 1 is complete concentration on the task. I think that's something that is obvious. It's very difficult to think of something else once you're in the process of doing a perfect neurosurgery. The number 2, clarity of goals and rewards in mind with the immediate feedback. That comes back to that concept, as I mentioned, of having a very clear vision of what your preoperative planning is going to be. 3, the transformation of time, speeding up, slowing down. That's also something that Erling Kage was telling me about, that suddenly you're suspended in time. And so it's silent and it's suspended. Number 4, the experience is intrinsically rewarding. Well, I'll tell you that for some cases, I would actually pay to do these cases. That's how much I enjoy doing them. And it's incredible to think that, you're getting paid to do something that you love, and something, once again, that's unique, that only a few people can do. Number 5, the effortlessness and ease. And that's why I'm saying to the residents, focus on the surgeons who make it look easy. Nothing of this is easy, but if it does look easy, it just means that he or she is doing a great job, and you should look at it. Number 6, there's a balance between challenge and skill, and we'll review that in the next slide. Number 7, actions and awareness are merged, losing self-conscious rumination. Yeah, definitely an important aspect of it. And for that, actually, I will go back to this slide, which I guess I missed, but our intraoperative thoughts are often distracted by the task at hand. We have to deal with the patient care. Often the family of the patient is part of our problems. There could be colleagues looking over our back. We have to deal with students. Legal, unfortunately, you know, the prospect of a potential malpractice lawsuit if things go bad. And that engenders a lot of fear. So sometimes we're like this little fisherman in this incredible print by Hokusai, little guy standing alone in that boat in the middle of this big ocean of fear. So it's vital that we are able to lose self-conscious ruminations, that during the procedure, we actually get into a state where, as number 8, we are feeling control over the task at hand. And so one of my favorite aspects of that book was this chart, and this will be close to the last slide, where you see the challenge level is on the left and the skill level on the right. So if you start at the bottom on the left, you have apathy. Yeah, so obviously it's not very challenging what you're doing and you don't need much of a skill level. So that would represent lying down on your sofa and watching soap operas. You don't need much skill to use the remote. But if you go up on the challenge levels and you don't have the skills and they ask you to do something, well, now you start to worry. And obviously, if they're asking you to do something and you have no idea of what you're doing, now you're going to start going into anxiety. On the other hand, what you're trying to achieve is this concept of flow, where you have a very high challenge, but you have the skill level set that allows you to respond to that challenge. And that's what obviously we have to aim. This level of challenge and this level of skill will be different for everybody. When it comes to neurosurgery, you know, it's really pushing the limit. You know, when you're flying a plane, that's a very difficult task, but there is a co-pilot, you can go on automatic pilot and so forth. In neurosurgery, there's still at this stage no automatic pilot. You're all alone. And if you want to have a good outcome, you need to be in that flow. So what I really wanted to get out of this talk is the fact that the flow that you have in surgery starts and begins and continues with the flow that you have outside of surgery. This quote by François-René de Vicomte de Chateaubriand, "A master in the art of living draws no sharp distinction between his work and his play, his labor and his leisure, his mind and his body, his education and his recreation. He hardly knows which is which. He simply pursues his vision of excellence and leaves others to determine if he is working or playing. To himself, he always appears to be doing both." So, you know, I think it goes both ways. It's important that neurosurgery doesn't define who you are, but it's important also that you define yourself by the task that you've chosen. And in that respect, that you accomplish everything around you to the best that you possibly can, so that you can enter that ecstasy of flow that happens when everything goes well. And on that, I'll just share a little QR code, which has the books that I mentioned, and also a shameless plug to the website of my son, Alex, who does the Polaroids. So thank you very much, everybody, for listening.
That is wonderful, a wonderful talk. Absolute concentration of everyone here in this room looking at what you presented, Frank. Frank, can you go back to that slide with the graph, that one? This is a really interesting slide, and I have thought about these things myself as well. But just I would make a comment that those of you who know me will probably understand from this talk why I feel like I have learned so much from Frank over the years. I consider you a really good friend, Frank, and continue to learn from you and really appreciate your perspective. One of the things that we talk about sometimes is humility. And what sometimes I have seen in trainees is that as the skill level goes up, you can exchange, well, control, a feeling of control occurs. And you can get relaxed, and you can even get a little bit cocky. And so sometimes if you superimpose humility on top of challenge, you can sort of find the same flow there. But there's so many thoughts that you brought up, and I would love to hear the comments of some of the residents and questions that you may have. How about a senior resident? Jeff, Frank, Travis, Kurt, questions, comments? Trevor?
Thank you so much for that talk, Dr. Moore. That was awesome. I just the concept of flow, I think, is very interesting. Just to take that from other aspects of in other high intensity situations, whether it's high level athletics or finding those connections from other aspects of your life to neurosurgery. I was wondering if we know that you have a very varied life and a lot of expertise in a lot of different areas, and any thoughts that you have further on continuing to bring in expertise from other areas to increase your effectiveness as a neurosurgeon?
Yeah, this morning, obviously, I was like thinking, okay, I'm going to be done with this talk about flow, and what would be my next talk if I ever had to give one? Obviously, I'm not so keen. I get quite nervous before I give one of these talks because, I can't rely on any data. So I have to talk extemporaneously, basically, which is not always easy. But I figured if I had to give another talk, it would be about the physicality and the art of neurosurgery, because it is such an intellectual endeavor, but by the same token, it's so physical. And when we train, we only think about the thought process that goes behind it, but it's your whole body that goes into it. We during surgery, we put our bodies into contortions. If you're a tall guy, suddenly you're leaning forward, backwards to try and accommodate the shorter guy, and you're looking, and the microscope may not be in the right place. Posture plays such a big role in everything we do. So the physicality is important, so that, you're asking me about other aspects of life that comes into play, and particularly in my life. So doing sports, yoga, training, all of these things, I think, play a big part as to how you can achieve a better result. And the art, because artistically speaking, it is also an art. I mean, that's what's so fabulous about neurosurgery. It encompasses so many things. It's a play. The whole operating room is a theater. It's art because you're recreating basically a sculpture out of human flesh. If you take this into the real world, then you're going to be interested in art. You're going to be interested in sculpture, like Dr. Bedison does. You're going to be interested in various aspects of painting or collecting or beauty, and it's really a gift to be able to be part of a neurosurgical procedure and a neurosurgical life, really.
Jeff Gilligan.
Thank you, sir.
Jeff, can you make a comment, please?
Yeah, thank you, Dr. Moore. It was a great talk. Yeah, it was great to kind of consider this just as I'm getting close to graduation and kind of start my practice going forward. But just as you said, it's something that you learn from watching kind of the masters that we see in our residency, and then trying to tie that into your own kind of personality of kind of the different techniques to use. And as you said, one of my big things is visualization kind of before a case. And that way, the things that you're going through is not really a surprise. It's kind of just going through what you've already imagined and just having that kind of command of the room too. But it was a great talk just to hear from you, and always you have always interesting talks. I really appreciate whenever we come by.
Great, my pleasure.
Frank?
Yeah. Hey, Dr. Moore. Thanks for the talk. It's really awesome to hear. My question for you would be, how do you avoid the butterfly type surgery that Dr. Bayou was talking about? For example, yesterday, we're missing a proprietary screwdriver when we're doing a revision fusion, and had to wait for that for almost an hour and a half. So how do you deal with keeping the flow going and going from being stuck in arousal there, going and moving over to flow?
Right. That's a tough one, and it's going to happen basically. And when you work, one slide didn't pop up, but basically you're working in the operating room not just as a lonely person, but you're part of a team. And in that respect, one of the points I wanted to make up is that as the surgeon, you're the head of that team. You cannot do the procedure without the people surrounding you. But sometimes some of the people in the team can be disruptive, and they can be, they can be incompetent, or they may be passive aggressive. We've all seen that. And in that respect, the one thing that I would say is that there is no place for anger whenever you face a situation like that. So if you have to wait for something to occur during the procedure and you have no choice, the best recourse to keeping the flow going in my book is having a sense of humor about it. And Dr. Bedison brought up the concept of humility, and humility and humor often go hand in hand. And to not take yourself too seriously, as much as it is a complex and difficult item, you need to be able to be very humble about what's happening. And if you have to wait, you try to make the best out of it. But if you have somebody who's disruptive in the team, you have to be able to either incorporate them into the team, or you have to be able to shelter yourself away from the team. What I meant by butterfly was really more of a mechanical issue, whereby you don't want to have your hands moving left, right. You really want to be focused on the task so that you let the flow of your hands directly go into where you want it to be. And your brain and your hands, everything has to be focused towards one task. And that's true both in cranial and spinal. I'm of the old generation that still does both. The flow may be a little bit different in both cases, but at the end, you need to be able to focus and avoid that butterfly thing. So I'm not sure if I have a perfect answer to a problem where there's a piece of equipment missing. My big thing about that is that all the technology that comes into play right now is very disruptive sometimes to the flow, because you have to do a spin, you have to do calibration. All of these obviously are going to be important factors, but they kind of slow you down in the momentum that you want to do. And it's vital to keep the momentum moving forward at all times. So whatever new technology comes in, you have to try to incorporate it so that it has a very good flow. And last week, actually, discussing, the intravascular surgery, Dr. Bettison also spoke about intraoperative angiogram versus Doppler versus this. You need to find, there are too many toys. You have to find the one that's going to work for you and that's going to give you the best workflow in your hands and with your team, basically.
Thank you so much, Dr. Moore. It's obviously spurred a great deal of discussion, and we thank you for presenting to us today. I think we're going to move to our next speaker.
I just want to say, while you're pulling up the